Hi everyone, it's Erin Mayberry with Rethink. We are going to give it another minute or two to let people sign on, so we will get started with the webinar shortly.
Erin, this is the first time we're doing a podcast-like webinar.
Excited for it. We'll have to do more in the future.
Yeah, we're doing one on collaboration, interprofessional collaboration with Lena Slim in April.
Perfect. All right. So I think we are going to go ahead and get started. So welcome everyone to another Rethink Behavioral Health webinar. My name is Erin Mayberry and I am Director of Community Engagement for Rethink. For those of you who are not familiar with Rethink, we are a behavioral health software solution. We offer clinical, scheduling, training, and billing solutions for behavioral health providers. Just a couple housekeeping items before we get started. We are going to have more of a discussion-like or podcast style webinar today. So there may be time at the end for questions. If you do have any questions, you can type them into the questions box on your panel, on your webinar panel, and we'll get to as many of those as we can at the end. We are recording this webinar, so you will have the recording available on our blog page in the next couple of days that you can go back to. So today our webinar topic is building compassion in collaboration with families of individuals with autism spectrum disorder. And I am joined today by Dr. Kate Fiske and Dr. Bridget Taylor. Dr. Kate Fiske is the founder and director of North Star Family Autism Center and a clinical associate professor at Rutgers University. She's also director of family support at the Douglas Developmental Disability Center, and she's worked in the field of autism treatment for over 20 years. Her clinical work and research focuses on best practice approaches to teaching children with adults on the autism spectrum. A particular focus of her work is on providing support to family members and other caregivers of individuals with ASD, and she frequently provides training to professionals on understanding the family experience. Dr. Fiske has authored numerous articles in peer-reviewed journals and is the author of the book Autism and the Family: Understanding and Supporting Parents and Siblings. Dr. Bridget Taylor is co-founder and CEO of Alpine Learning Group and senior clinical advisor for Rethink. Dr. Taylor has specialized in education of children with autism for over 30 years and holds a Doctor of Psychology from Rutgers University and received her master's degree in early childhood special education from Columbia University. She's a board-certified behavior analyst and licensed psychologist and is past president of the Behavior Analyst Certification Board and past associate editor of the Journal of Applied Behavior Analysis. She currently serves on several editorial boards and the Autism Advisory Group for the Cambridge Center. Dr. Taylor has published numerous peer-reviewed research articles and book chapters on innovative practices to improve the lives of individuals with autism, and was recently recognized by the Association for Applied Behavior Analysis International for her outstanding contributions and was given the fellow designation. So I'm going to turn it over to both Dr. Fiske and Dr. Taylor.
Thank you, Erin. Well, thank you, everybody. Thank you for being here this afternoon. We're very excited because this is going to be a little different than our usual webinar format for Rethink. I'm very excited that I get to spend time with Dr. Kate Fiske, who I admire greatly. And we're going to have a discussion and learn from her about what it's like from a family's perspective to have an individual with autism and some of the variables related to what families might go through, some things that we can do as clinicians and practitioners to help families along the way in their journey. And I'm just really excited that I get to have this conversation with her. And so, Kate, thank you for being here. And I thought we could start out with just a discussion. Help us understand, how did you get interested in this area of focus of working with families in particular, and why the focus on the family?
Sure. I have been very fortunate in my career to have worked at a number of amazing institutions. And one of the first institutions that I worked at, New England Center for Children up in Massachusetts, they had a very strong home-based model. So I was working in the school with the child, but very frequent home visits as well. And that was just such a nice opportunity to be in the home regularly with the family and connecting with them in a very different way. But I think we sometimes lose when we're just focusing on a child in the school setting. And I also have to thank the parents that I worked with in that setting, because they were so forthcoming and honest about their experiences. And I still can remember conversations, meetings that I attended, just watching the parents experience the range of emotion as they raise these children, right? Just absolute like pride in what they were accomplishing, but still working through the grief that they were experiencing as parents of these children. And I was very, really kind of captivated by the strength that they experience as they're kind of going through all of this. And so my graduate career was also at Rutgers, as was yours. And I worked with Sandra Harris, who is just an absolute amazing person in the field of autism treatment. And her focus, in addition to ABA for autism, was on families. She's published widely on the experiences of parents and siblings. And she was an incredible mentor in that sense, and very much kind of continued to push me to learn more about. So my dissertation focused on, and it's really where I've continued to focus as I train students now at Rutgers, right, is making sure we build up that compassion for families.
Yeah, that's terrific. And, one of the things I love about your book, by the way, this is Dr. Fiske's book, which I highly recommend it, and I rely on it often. And when I speak about compassion, I often reference Kate's writings about what the emotional experiences are like for parents. And I wondered if you could talk a little bit about what those emotional experiences might be like, knowing that no two families are alike, but what are some of the common themes that families might be experiencing that as clinicians we should know about?
Yeah, and I think it's funny to hear you say, like, no two families are alike, but the emotional experiences are so similar across families, right? Regardless of the path that's gotten them where they are. And when I was writing that book, and when I do support groups with families, I'll have parents in the same group who have very different children, different diagnostic experiences. The treatment for those children are different, but they can still be, kind of brought down by the same things, right? The grief that they're experiencing, or the anger that they feel, they are talking about the same emotions. And I can have parents of adults connect with parents of newly diagnosed children about the same things because of that emotional experience. And so, when I think about, like the time of diagnosis, there's a lot that is wrapped up into that period. And when parents talk about it, they can often talk about, again, even if they have a child who is an adult, they can talk about that period of diagnosis like it was yesterday, like when they got that diagnosis. It really is almost like a flashbulb memory for a lot of those parents, because it was such a stressful event. And they talk about a range of emotion even at that time, right? And so certainly, there's that grief that I mentioned, and they'll talk about, and several parents will share that grief as feeling like somebody died, and really saying, like, having my child diagnosed with autism was like losing that child, the child I thought I had, right? And really talking about it like it was a death in the family, and waking up every morning and wishing something would change because that feeling was just so unbearable. But there are other emotions that are wrapped up in that, right? So parents might feel a lot of anger towards other family members who may have noticed the symptoms, or who are or aren't supportive, towards professionals as they're kind of grappling with the early steps that they have to take. Also, relief for a lot of families, right, who have been searching for some reason for why their child is behaving the way he or she is. And so finally having an answer and feeling like there's a path forward, right? And so certainly parents will talk about that. Guilt is wrapped up in there. There are so many emotions that parents will talk about during that period of time. And I wish I could say that that's it, and then it kind of gets easier over time, but we've seen that that's not necessarily the case.
Yeah. One of the things I've noticed and observed over time with the families here at Alpine is that there's often certain stages in a person's with autism's life cycle that a family might experience these feelings again at certain key points in a child's development. And so, for example, I noticed that there are certain feelings that happen when a preschooler turns kindergarten age, and they may not be going on to kindergarten. That there's some feelings that come up around adolescence and the sweet 16 and the getting the driver's license, not getting the driver's license, things that come up for families. And so how might these emotions change over time, or are there it's not as if you go through the emotions early on and then it's all done. What are some of the issues regarding life cycle and changes over time?
Yeah, that's exactly, when you're talking about how I got into this in the first place, that it was those types of observations that really pulled me into this area. And I remember, one of the meetings that was so pivotal for me was a mom in a meeting with having a discussion about her son who was not going to be able to move out of this self-contained classroom to a general education setting. And desperation is the only thing I can use to describe that. I mean, she was just sobbing and saying, well, we can put him into an inclusion classroom. Maybe we can teach him the skills that he needs, just kind of grasping at straws. And I really started to think about that period of time as like this second diagnosis for a lot of parents, right? They get that first diagnosis of autism, but we know from media, books, all of these things that parents are exposed to, that any parent has the hope that maybe their child will be like those other children who becomes virtually indiscriminable from their peers, right? And they hold on to this, but at some point, somebody may tell them that's not going to happen. And so really this period of another diagnosis that's handed to them, that's your child is going to have autism like this for their life. And so that really was really remarkable. But absolutely, we see it at, parents will talk about birthdays, right? Like every birthday is a period to like look back and say, well, what hasn't he accomplished, right? Oftentimes we're celebrating at a birthday. And so a lot of parents will say that birthdays don't have that same meaning for them. And so there is certainly this resurgence over time. And I worked with a father who said that when his son was diagnosed, he was working with a professional who said, you feel this intense emotion now, and you're going to feel that like giant bombs that are dropped in your life repeatedly. And he said, that's exactly how it is. He will all of a sudden, things will be fine. And all of a sudden this giant bomb of emotion explodes that is triggered by maybe some transition. Sometimes it's not even a transition. Sometimes it's something small, where it's a parent suddenly has an opportunity to compare their child and his or her progress to other children, right? And that kind of totally catches them off guard. And I tell clinicians to be aware of that, right? Because certainly we see kind of these life cycle events that we need to be aware of and think about the impact that will have on parents. But we also need to recognize that those resurgences of grief and stress can happen on any day. And we don't know when that's going to happen for parents, and parents don't know what's going to happen. And so if you have a parent who is really in a space where they're not able to connect with you, or maybe they're really emotional, to not think that it's necessarily your relationship with them, but there may be other things going on for them emotionally that are impacting that moment.
Yeah, and I think that's a really valuable point, is that as clinicians, we want to have an understanding of what the experiences may be like for a family, and that should inform our understanding of why families may be engaging with us in particular ways. And so can you speak to how the emotional life of parents might actually impact their engagement in treatment at various points in time, and again, how we as clinicians might need to understand that?
Yeah, definitely. I think one of the important things to know about parents, and we've talked so far about kind of emotions, is just the stress level that parents experience. And we know from research, and a large body of research, that parents of individuals with autism are among the most highly stressed parents. When you compare them against virtually any group, they really have this stress level that exceeds all other groups that we look at. And with that comes significant impact on mental health, right? And, you know, certainly also kind of these extreme emotions will also impact their mental health. So we see among parents of children with autism higher rates of anxiety, depression. We tend to see it even higher among mothers than fathers, but we see it among both. And when we think about that, we think about, you know, the emotions they're experiencing and kind of how that's going to increase and decrease predictably and unpredictably at times. You think about that stress level, you think about the impact on their mental health. It stands to reason that there are going to be a good number of families who are going to have difficulty engaging in what it is the professionals are suggesting to them, right? And so that's a big piece of what I work to do in educating professionals, is how to make sure that we better understand parents' experiences, so that when we're trying to collaborate with them, which is totally the cornerstone of what we're doing when we're working with individuals with autism, is working with the family and parents, when they're not engaging, really recognizing all the things that are going on behind the scenes for them, and being able to better understand what they might be, you know, up against. You know, both practically speaking, as they're managing everything that's going on with their child, but also emotionally, mentally, as they're grappling with their own things, can very much impact their engagements.
Yeah, that reminds me of an example I had once with a family where the team was really really unhappy with the engagement of the parents in the treatment process. And you know, early on, the clinicians were in some ways judgmental of the family and were critical and said, you know, if the family really only spent time working with this child, there would be so much more progress. And, you know, we had to really regroup and refocus and recalibrate in many ways our goals for the family, with an understanding that their capacity to engage in treatment was greatly impacted by the stress that they were experiencing related to the diagnosis of their child. And I think, you know, that's really important as clinicians, is that we don't judge the family, and we have a real understanding in many ways of where they're coming from. Yep. In the process of acceptance, in the process of engagement.
Exactly. So, I wanted to jump in for a quick second to talk about the fact that coping also plays a large role in that, right? So people who experience stress have a variety of different ways that they'll cope with that stress, and some will be very problem focused, right? And those are the parents who tend to kind of jump all in, right? They've read every book about autism treatment, they know the treatment their child should be getting, they're ready to jump into parent training, and they're there with you, really figuring out how I'm going to solve this problem, right? And that has benefits, it absolutely does. That can also be a challenge when parents aren't making the headway that they want to with their child. There's also another type of coping called emotion-focused coping, where it's figuring out how to manage you know, these emotions that we're experiencing. And there are adaptive and non-adaptive ways of doing that, right? And so adaptively, and you just mentioned that, Bridget, like moving towards psychological acceptance, right? Really kind of recognizing your emotions, being non-judgmental about the fact that you're experiencing them. How are we moving towards what's important in our life? That kind of approach. Non-adaptively, that's where we see parents withdraw, right? And so when we have parents who cannot cope with these emotions, their approach to dealing with that is just to pull back. And shut out what it is that is making them face that, right? Like being involved in treatment, like implementing these interventions. And so a lot of what it is that clinicians might see is not just the stress that parents are experiencing, but also the coping strategies that they're using to try and manage that stress or manage those emotions. And I think the challenge for a lot of clinicians, especially when we're in the field of ABA, or any other, you know, related service, is that we're not necessarily in the position to teach parents how to cope, right? That's not our job as behavior analysts. Right. There are professionals who can certainly do that, but that's not something that we are trained as behavior analysts to shift. And so how do you work with those parents who have different coping strategies? And it looks like, you know, you had to think about, like, that team in particular, how are you going to adjust your approach considering how it was that they were coping?
Yeah, and I think, you know, it brings to mind that as professionals, we want to have resources to refer families to, and to really be able to recognize when what the family may be experiencing is extraordinary to what our typical experience may be with families. And again, knowing there is no typical, but as clinicians, knowing when to make a referral for mental health counseling or parent support, I think is really, really important. Can you've talked about some of these emotional experiences. Can we predict what parents might be experiencing, and are there variables that might impact that stress or reduce participation? You've talked a little bit about that, but I think it's hard for us to predict. And can you talk a little bit about what could be, how we can know when there may be more stress or less stress?
I think that, we talked about kind of like the transitions in life, right? That's one piece of it that can be, something that's a big part of it, but also some of the things that we might be able to use to not necessarily predict, but to get a better sense of how, what exactly parents are trying to cope with. One of those is just their child's symptoms, right? So when we're talking about social concerns, communication concerns, those are going to be significantly related to parents' overall level of stress. And so the more significantly their child is impacted in those areas, the more stress that we can expect parents to experience. The number one driver, study after study after study, is the level of challenging behavior. And so when you have a child who is exhibiting behavior that is really impacting the family's ability to kind of integrate, meaningfully in a community, or to seek support from family, or even just to feel like they can be home in a level of peace, right? Because certainly parents are impacted that way. That is going to be a big driver for parent stress. And so when you have a child like that, you can assume that their level of stress is going to be pretty high. But then in addition to, another big piece actually is the reliance on the parent, right? And how much care that child requires. And, that, as we know, for individuals with autism, that level of care can persist much longer than we would expect among neurotypical children. And so you have parents who are providing significant care for adults, right? And that is going to have significant stress as well. And we're working with a family with an adult son, and just talking with the parents about the stress that they experience, feeling like they were supposed to be retired, right? They were supposed to be retired. This was supposed to be a period of their life where they were really able to kind of slow things down, but they're still providing a significant level of care, and they're tired and they're exhausted, and just really what that feels like for them, right? But in addition to that, it's all of kind of these extra pieces of life that we need to, as clinicians, consider as well, right? So the impact that having a child with autism has on a family's financial concerns, right? So certainly there's a financial impact there. The impact that it has on the division of labor. Maybe one parent left the workforce, right, to provide more care. And what does that do to that person's identity? And kind of how their interactions are, which leads me to the next thing, just the quality of the relationship between parents. There is evidence that there's more conflict in families when a child has autism. Divorce rate can be affected when the child has autism. So how's that playing out? And then we've got siblings, right? Another piece in there. So you look at kind of all these moving parts that families are taking into account, and how are all those, and I think you can't sit there and say, well, this is intact, but that's not, and this is here, and so this parent is going to be extraordinarily stressed or not. It's hard to make those calls, especially because when you add in the layer of coping, some parents cope really well and are incredibly resilient given all of their stressors, while others might not be. But what I think is helpful, and what I've done with professionals, is essentially given them the list, right, of like, here are all of the things to consider. And when you consider all of these risk factors for having more stress, where does this put your family, and how does that make you think differently about how you're approaching your care with them? And I think that is helpful. So it doesn't necessarily predict, but it helps them think about how to conceptualize their work with this family and approach it in a more compassionate way.
I would imagine that, and I wondered if you could speak to, or is there research indicating that the support systems or the support networks for families are a variable? And one of the things that we are doing here is building out what we call our case conceptualization with families when we onboard them, and to really look at some of these risk factors for stress, but also what is their support system, so that we have an understanding of that system. And I'm just wondering, is there research that indicates that support systems, and whether we should be asking about these so that we can have, that can be helpful?
Yeah, absolutely. Yeah, there's a significant body of research that looks at social support for families, and similar to challenging behavior, it tends to be one of those big drivers. The more social support that a parent reports, and I think that's a really important thing, right? It's not necessarily how much they actually receive, but how much they perceive that they receive. That's the driver. Do they feel supported? Do they feel like they have enough support? And that is related to their stress level. And so that's another big piece that I'll focus on with clinicians, because a lot of times clinicians are just focusing on themselves. Well, I'm their teacher, I'm their behavior analyst, I'm not social support. But it's a form of formal social support, right? Absolutely. These clinicians that parents are interacting with are social support. And so really teaching professionals to recognize that they have that role doesn't mean that they need to be a confidant, a friend, a therapist. It's not necessarily the role, but recognizing that they can still take steps to provide more social support to this family. But at the same time, figuring out how they're going to connect families with more social support in the absence of, right? So a lot of families are living distantly from family members. Even if they have family members close by, they'll say, well, my family doesn't get it. They're not able to provide the support. There's a significant loss in peer networks because it's difficult to find other parents who have similar experiences. And then because you have a child with autism, it's very hard to spend time together once you do find those parents, right? For any number of reasons. And so that can be a challenge for parents. And so trying to figure out how can we better connect families with one another is one of the charges that I put to professionals. And it can be tricky, right? With everything else we have on our plates in terms of providing care for individuals with autism, always keeping an ear to the ground for resources that families might be able to turn toward, right? And maybe it's something that's more systematic. Maybe it's a social support group that you know of. Maybe it's a phone line, right? Like Mom to Mom is a New Jersey-based, phone connection that you can make between parents. But maybe it's one-off events, right? So something, especially now as the world reopens a little bit, where restaurants have, autism-friendly or sensory-friendly is often what they call it, events, right? At a restaurant or at a movie theater or to see a play. And what parents and actually siblings of children with autism will report is that those sorts of events are so comforting because they go and everybody there gets it. So in one swoop, you're connecting parents with other parents, which can be really helpful, but you're helping reduce the stress that they experience in entering into the community, where they might feel that there's stigma or that they're being judged, by providing them an opportunity to interact in the setting where there is not necessarily that judgment.
Yeah, and I think of it as decreasing isolation in a way. It's what can we do to have families feel less isolated? A lot of the times when we're working with families who have toddlers, very, very young children, they may not even be out to their family members, other family members, that their child has the diagnosis. And so, that comes on our radar as this is a family that will need some support along the way because they're not getting that support from their extended family members. Yeah. So, this makes me think about a lot of other questions. And as behavior analysts, I often get asked, how do you help families, but also maintain those professional boundaries that we're guided by with our ethical code? Mm-hmm. And, should we be asking families about their mental health? Are there other ways that we could support them? You talked a little bit about, having them access supports in the community. Maybe some guidance, because I think clinicians might think, well, what is my role here? And families invariably will have these feelings, but I also want to make sure that I'm not engaged in a dual relationship, in that I'm not their therapist. How do I maintain those boundaries while still being supportive?
Yes, yeah, absolutely. And I think that that's one of the big challenges. And I think, with BCBAs, there tends to be kind of this line drawn a little bit, right? Where it's just like, I focus on kind of the behavior of the child, the behavior of the parent, but once we start getting into kind of the emotional aspect of things, that's where I cut out, right? And I think that there are a lot of ways to not necessarily provide therapy for parents. That's not what we're asking professionals to do, or these types of clinicians to do, but figuring out how to incorporate compassionate behaviors in the work that you do with the individual with autism that will also support parents along the way. And one of the biggest things that I talk to clinicians about is just listening. And that goes such a long way with a family, right? Because if you think about, what we just talked about in terms of their social limitations, they might not have anybody to talk to about this, right? And so just being able to talk about and air their concerns, their fears, their emotions, oftentimes you have to say very little in response to a parent, but just hear them, right? And then validate what it is that they're experiencing. And that's where, this kind of context, I think, can be really helpful for professionals, because then you at least have the context to be able to respond to parents and just say like, oh my gosh, yeah, I can absolutely understand how many things that you have on your plate, right? And being able to validate that experience or validate the specific emotions that they're experiencing without having to say, well, let me figure out how to help you reduce that, right? Just being able to listen in and of itself is a very compassionate behavior that clinicians can use. And I think that there are places too to figure out, well, what can I do to help potentially reduce emotions or stress related to something that I'm doing, right? That's another big piece of it. So I think, a good example is when a student transitions from one classroom to another, right, in a school. And for parents, and I remember one parent telling me, her son at the time was older, she's like, I'm exhausted. Do you know how many classrooms he's transitioned through? Do you know how many staff I've had to get to know? I'm tired of all of the work that goes into those transitions, right? And so I think that something like that, and that's one of those times where you're like, the stress is going to increase during this period of time. We can, really kind of predict that a bit. So this is going to be a time I'm going to check in with the parent, right? And I'm going to say, how are you feeling about this transition? Let's talk about that a little bit. And again, we're not getting into like, talk to me about your stress or talk to me about your anxiety. Let's figure out how to address that. No, we're saying as behavior analysts, what can I do in this transition to make this easier or more predictable for this family, or make the connections easier as they're doing this transition to help reduce that stress, which essentially becomes very behavioral in a sense, because we're kind of operationalizing what it is that we're going to do. And I think that those are the steps when we're really being aware of kind of like the impact that those things can have on families' mental health, well-being, and taking steps we can control to reduce that. That alone is, being compassionate in terms of approaching that family.
Yeah, and I love the idea of as clinicians taking responsibility for checking in with families on a regular basis during it's almost like anticipating, well, this is likely going to be stressful, so let me be proactive, and what do I need to do on the front end of this transition or this change to prepare families.
Yes.
And also just to check in along the way. I mean, I think even for some of our early learners where they start their in-home programs and suddenly they have 4 different people in and out of their home all week, pausing to be like, well, how is this for you? How's it going? Having people in and out of your house, and, just a touch point. And I think that we underestimate the value of just asking somebody how it's going, just pausing, pausing in the process and saying, what is this experience like for you? You may not be able to make it better, but at least just being thoughtful enough to ask about it, I think is.
Well, I think just asking is validating in and of itself, right? So taking the time and saying to parents, like, this period of time can be stressful for parents. How are you doing with it, right? And just kind of putting it out there that this is something that commonly is stressful for parents. Or, I mean, you mentioned, people coming into their homes, and that is, I've heard time and time again, parents having that initial stress as they're not only trying to like work through everything with their child, but they're worried about what their house looks like every single time somebody comes in. And over time, they adjust to that, right? But that's a really stressful thing. And so talking to them about what that feels like and what that's like to have their family and all of their family interactions in a way very on display, right? And what can you do to help make that feel better? And again, maybe you said, maybe there aren't a lot of things that you can do to change that. But again, just asking can be a good step.
Well, I've had a particular interest in the last 5 years in the area of compassion, and my colleague Linda LeBlanc and I have done some research in this area that you're familiar with, and it's I'm really excited because I think the field is heading in a really great direction for incorporating these ideas and these concepts. And so maybe speak a little bit to where compassion comes in our understanding of families. You mentioned listening, checking in, touch points, it's kind of shifting, and then where this also plays into this idea of collaboration. And our job is to collaborate, right, with families in treatment approaches. And so where the compassion comes in, and then specifically really how you reach the point of collaboration.
Yeah. I mean, and I have to, stop for a moment to reflect on your research, because it has been when those articles came out, yours, the one that Linda had authored as well, as a group together, just have been so amazing in the field, in terms of having just something to turn to, a resource to turn to say, this is how we're doing, right? And your findings are like, behavior analysts aren't doing great in the area of compassion, and then Linda looking at kind of the training and where we're going with that. The number of times that I have downloaded and sent your article to other colleagues just speaks to how important it is in the field.
Well, I will say that those data are going to be obsolete, because we're doing so much better already.
I hope so. And it is promising, right? And I attended ABAI last year, and just seeing the increased discussion of compassion in families was really, really refreshing. And again, it takes, I think it takes articles like that. I know you've been doing a lot of work and kind of talking with different groups about how to incorporate compassion. And I think we're starting to see that shift. And I think another big piece of it is the increased and deserved focus on diversity, equity, and inclusion in ABA, which has another big increase in the research, and I'm so glad to see it. But work especially with families, focusing on culture, background, that is naturally compassionate, right? They're very, very tied together. And so when you're talking about collaboration, I think, one of the big things, and I teach a graduate course, and just this week we were talking about how do we talk with families about their goals for their child, right? And that's where compassion comes in, collaboration comes in, and how do you approach this to understand the family context, right? Understand the family context, understand their goals for the child, understand their understanding and their cultural understanding of disability, what is a meaningful outcome for them, and having those discussions to best identify where you're focused as a professional, right? And what goals you're selecting. Certainly there are enough stories where you are choosing, well, I have run the VB-MAP or the ABLES, and I've selected this goal as the one that needs to be increased, and the parents have no interest. It does not align with what their values are. Maybe it doesn't align with kind of their cultural values, all of those pieces. And so taking the steps to make sure we're having those conversations with parents early and often about whether the steps we're taking are aligning, again, with their family context, and what they're able to do as parents, I think, as well, is important, right? Especially if we're talking about like a behavior intervention plan and addressing something related to behavior. How will this fit in at home? How do we adapt this to their context so that it is actually something that is manageable, doesn't add a tremendous amount to their plate? I mean, it certainly will. Behavior, tends to do that. That's why it's such a huge driver for stress. But how do we adapt it so that it is, kind of adding the least amount possible? I think all of those pieces are going to be important.
Yeah, and I think sometimes we just simply fail to explicitly state our intent to collaborate.
Yes.
So, sometimes even just saying our goal is to work together and to make sure that the goals that we're picking, we both think are in line, and sometimes explicitly stating that is really important. Just,
Yes.
we want to intend to, and part of this process is collaborating. And I think conversations with families inevitably reveal barriers to treatment. And if we don't do a big enough dive in understanding what's important to families and where their reinforcers are, we will invariably come up against barriers and our treatments won't be effective. And so we could have the best, well laid out plan, but if it's not important to the family and we haven't really talked with the family to find out what's relevant for them, that treatment won't be implemented.
Yes. Yeah. You know, and I think another important piece for clinicians to know is that you can be the most collaborative, compassionate clinician possible, and you will still run into issues in collaboration, right? So just being a compassionate clinician is not going to mean like, absolutely, you're going to have that IEP squared away and everybody's going to agree on what's in it, right? Certainly there are going to be points where parents are pushing for a skill that maybe you think their child isn't ready for, right? Or there's several steps we need to complete before we get to that. But I think that there's a lot of compassion that can be brought into those discussions as well, right? Instead of just shutting a parent down and saying, as a behavior analyst, I know best, he doesn't have the prerequisites, right? Is really thinking from the parent's vantage point, why are they pushing for this? What is this a signifier of? Why is it so important for them? One of the things that I talk about often are parents who push for reading goals when they have children who are not, quite even, identifying letters yet, but reading is so important. But if you think about reading is such a marker of success in our society. Right? It's a marker of success. It's a marker of independence. It's a marker of having leisure skill. There's so many things that are wrapped up in reading. And so having that conversation with parents about like, why is this skill so important to you? What is it about that skill, right? And if you have that conversation, it's pretty likely that you as a clinician are going to be able to map onto something and say, well, that is where we agree. Right? Absolutely. We both have the same goals actually for your child. So let's figure out what we need to do to make sure that we're moving in that direction, that we're moving towards what you value and what is important for you as a family. And I think that can really go a long way when you have those interactions where, you're not seeing eye to eye with families.
Yeah, and I think it's really reasonable to ask families, tell me why this, I want to understand why this is important and valuable to you. So help me understand this. And, that area of compromise becomes really important. And families, there's always a place, there always can be a point of compromise. There always could be something.
Yep.
And I think, in the last 2 years, all of us managing COVID and families who are stressed and having to go to virtual and kids wearing masks and not wearing masks. And there were so many conversations that we had with families about rules that we had to set up and things that had to be in place, and being able to just listen to them and understand, well, what is this about this particular thing that we're doing? Tell us how we can meet in the middle here. So often it really was about having conversations, like you say, with families, having those conversations, getting the information that we need. Can you speak a little bit about just rapport building and why that's important? And I think we underestimate that. I think of you've probably seen my talk where the father, a gentleman by the name of Kevin, who talks very eloquently about his experiences with clinicians, and he talks about things that he wishes clinicians didn't do. But there's this sense that when I work with, a lot of times clinicians are all business. They go into a home and they're all business and they just want to get down to the assessment results, start the treatment and do the FA and solve all the problems in the world. But there's this subtlety and this nuance to rapport building. And again, what comes up time and again is like, well, how do I be friendly without being their friend, and how do I build that rapport? And maybe some maybe examples of how clinicians can build rapport and have those foundational relationship experiences, because that relationship is really going to be essential for trust, for collaboration moving forward.
Yeah. And there's a lot of research, not necessarily in the area of ABA, but just in general psychology, right, about the importance of rapport in outcome for treatment. Carl Rogers did tons of work focused on that really client-centered care. And we can pull a lot from that research to say, well, what should we be doing in the context of ABA that can help build that rapport more effectively? And so there's so many, great texts to turn to. Nancy Boyd Franklin's wonderful faculty member, just retired from Rutgers, and her work on working with families, joining with families is just exactly what we need in behavior analysis and in terms of how to build those relationships. And it's funny because there's so much humanity in it when we're talking about rapport building, because they're not groundbreaking approaches. It's things like asking families about other things that aren't related to autism, right? What do you do for a job, for work? And do you have any pets? Do you have any pictures of those pets? Where are you going? If they have a vacation planned, where are you going, right? Talking to them about those elements and having that ability to really connect with families outside of their child's diagnosis. But I think more important than asking them those questions is listening, remembering, and recalling that at another time.
Yeah.
Because then, later, the next time you see them, you can say, oh, I remember the last time we talked, and you can talk to them about whether they were going on vacation or they were taking somebody to an appointment and follow up, or remembering what siblings' names are, right? How is so-and-so doing? And as a parent, for me, if I have a doctor who can remember all of my kids, I bring one kid in and he's asking or she's asking about another child, awesome, right? That's a doctor who has really focused on the entire family and has learned to build that relationship. So again, and I've said it a few times, like a lot comes back to that listening, right? Listening and conveying understanding, I think is going to be important. There's also in rapport building a lot of focus on being very non-judgmental, right? And respecting what it is that this parent brings to the table, right? I think sometimes BCBAs, and especially these days, there are a lot of hurdles that they're clearing to get those credentials, right? And so there can be this, sense of authority when they go in to work with families, this expertness, but really remembering that parents are the experts when we're talking about these kids. They might not know ABA, but they know the ins and outs of this child. And oftentimes siblings are actually better experts than the BCBAs in terms of kind of seeing what's going on. And so really, thinking about that. And again, when there's points of disagreement or parents proposing treatments that maybe you don't think are going to be effective, is approaching that in a non-judgmental way, right? And really understanding kind of where it is that they're coming from in terms of just wanting to help their child, right? And how are you going to approach that compassionately? And I think one of the biggest things is I had a lot of conversations with families about what makes a good clinician, right? When they're remembering back to the clinicians that they've worked with, who is it that they think of? They said, it's the one who loves my kid. And I think it's one of the easiest things, I think, to do as behavior analysts, because the reason that I got into this field in the first place was because I love these kids, right?
Yeah.
I just think they're incredible, amazing. And sharing that with their parents means the world. Telling a parent what it is that was so funny that their kid did today in school, and being able to kind of laugh and share that with a parent is awesome, right? Or sharing your pride about what it is that they were able to accomplish. And I remember I did a training for staff, and the staff member had reached out to me and said, I sent this parent an email just to say, like, look what he did today. Isn't this awesome? Like, not in a home log, just a separate email. And she said, the parent wrote back and she's like, thank you so much. This made my day. And that's such a little thing, right?
Yeah.
So oftentimes it is the little things that really can make a big difference in building that rapport, that effective relationship, where you can then grow treatment from there.
Yeah, and I think that I'm so glad you brought this up, because families also do experience joy amid all of this stress, and we can be barometers of joy.
Yeah.
We can point out the joy and we can model the joy. And so when we're excited that a learner has accomplished something that they've been working on, share that joy and really join in the celebration of the accomplishment. And I think that that's really important, that as clinicians, we remember to do that. There may be a heavy focus on, where's the deficit that we need to teach the skill related to the deficit? What's the problem behavior that we need to decrease? But we want to also make sure that we're pausing and celebrating those very small successes for families and modeling that, which can, I think, in many ways help with the stress and the sense of despair that some families might experience.
Yeah, and I think, you know, again, in conversations with families, and I you saw this in your research as well, is that we do have this focus on deficit in the field of ABA, right? We're always trying to fix things. We're always and you know, from a compassionate stance, right? We want to improve the lives of these individuals. So here are the things where there are challenges, and we're going to make them better, right? But then families who are like, oh my gosh, the data, like just put the data away for, you know, and we need our data. It's a very, very important piece of what behavior analysis is, absolutely. But sometimes those data sheets and those graphs are getting in the way of our ability to kind of connect with these families, right? And so yes, absolutely our data should, you know, our decisions should be data-based. We should be sharing that with families, but making sure that we're sharing those anecdotes as well, right? Sharing those things that are joyful, where we see them making incredible progress. And maybe it's not captured in today's data point, right? But it was a really neat instance of, you know, something that's shifting, or something that's really exciting, or something that was really funny, that again, parents can share in that joy, as opposed to just focusing on a graph, especially if that graph is not necessarily going in the right direction, right?
Yes.
And so I think that that's a really important piece, because we're constantly entering into these meetings that are data-based, as they should be. But what else are we bringing to that meeting to make it a little bit more tenable for families?
Well, we're down to about 10 minutes, and I wondered if you could give us some thoughts for the future, and, you know, either where we think some good research should take us, you know, where we may be heading. I'm feeling optimistic in terms of, I've had the opportunity to sit on several dissertation committees, so people are interested in this topic and this work. Ironically, it really has been in the literature for a long time. I think it's getting a resurgence in many ways, right? Sandy Harris talked about, she was also one of my mentors. She talked about this many years ago about partnering with families, and it's not necessarily new, but I think it's getting some resurgence and incorporating the idea of actual compassion into the practice. So give us some thoughts about where you see us heading. Any good research ideas? What are your students working on? You know, where are we heading?
Yeah, I mean, I think there's so many great directions for research related to compassion. You know, there are other fields that are ahead of us in terms of having a good grasp on how compassion actually affects things related to client satisfaction, treatment outcome, right? And that's kind of where we can focus our energies as well. And it doesn't need to be the sole focus, right? You might be able to incorporate, you know, compassion into other packages and see whether the addition of, you know, certain elements that are related to compassion might be able to alter, you know, outcome and satisfaction and those sorts of things. The challenge for us is going to be defining it. And I think that and you and I have had these conversations and tinkered with some ideas about how are we defining compassion. I know you've said, you know it when you see it, right? But you know, what does it actually look like? And you and your group had done a really nice job kind of providing guidelines of like, what are the behaviors that we really hope to see, and how might we structure really kind of a curriculum around teaching it. And I think that that's a big piece for us, is going to be, how are we teaching clinicians to be compassionate? And also making sure that the compassion is not just rote lip service, right? I think that that's a big piece, not just pat statements that clinicians know to use because I'm being compassionate if I use those statements, but really figuring out how to connect with the family experience and make that something be meaningful. And so there's work there in terms of how do we define it, how do we teach it. I do have students who have looked preliminarily in the context of supervision, is really where we've focused it currently, because certainly there's room for compassion in the area of training when we're talking about behavior analysts. And Allie Hawkins recently completed her dissertation and was able to teach supervisors to incorporate compassionate statements and feedback that they gave to staff.
Great.
And saw a nice improvement in that. And so that's just like, it's one small piece of the puzzle, but it was a compassionate behavior. We were able to see it shift. Amanda Austin is another graduate student of mine who will hopefully defend her dissertation in the next week or so, but found that compassion in the area of supervision predicted staff burnout. And so the more compassionate supervisors were, the less burnout the trainees were reporting. And so there's that connection there. So I think that there's a lot of different directions that we can go. That's in supervision, but what happens in the context of families when we're using these compassionate behaviors? But there's baby steps that we have to take first, right? Is figuring out how do we capture that? How do we train that? And then how do we blow it up to look at outcomes for individual families, but then also potentially programmatic, right? We have a focus on kind of single subject research and ABA, but can you look larger scale and see whether you see those effects there?
Yeah, that's great. Well, I know Erin's in the backdrop. We have about maybe 4 minutes that we could take questions. I really appreciated this discussion. Kate, I know that you also have a slide that I'd love for you to pull up that has your book, if people are interested, in contact information for Kate Fiske. I highly encourage all of you to order this book right now on Amazon. And you'll find it very, very helpful. It's a resource that I turn to over and over again and have my staff read as well. And Kate has a center that the North Star, so that if you have families in New Jersey who are interested in services, she provides services and in a clinical setting. And so, Erin, do you want to see if there's a couple questions in the chat?
So far, no questions. If anyone does have any questions, again, feel free. We got a lot of comments though. Great topic. Thank you so much. This was fabulous, very informative, inspiring interview. Love the format. We definitely do agree. Love the format and would love to continue doing this. So glad that you all enjoyed that. Want to thank you, Dr. Taylor and Dr. Fiske, both for joining us today. And Dr. Fiske, please tell Amanda good luck on her dissertation defense.
I will. Exciting.
Kate, you know there's a special issue in the BAP is having a call for papers on compassion, so your students will have.
We have flagged it. They're ready.
Good. Well, listen, this was a really great conversation, Kate. Thanks so much for joining us today. And thank you, everybody, for being here. It was great.
Absolutely. Thanks so much, everyone. There will be a recording available on our blog in the next few days. So you can go to the Rethink website to find that recording. Hope you guys have a great rest of your afternoon and a great rest of your week. Thanks so much. Bye.
Bye-bye. Take care.